Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today is Tuesday, May 18th, giving you the update from Albany Med. All right, Fred, we've done over 100 of these.
Yeah, we have.
And I still can't figure out how to put the microphone on.
You're getting better at it.
Dave had helped me. 100 times, still can't figure it out. All right, first graph, Capital Region, people currently in the hospital identified with COVID, 61. A week ago when we did this, it was 73, so it's come down by about 10.
Yes.
Regional call today?
Same thing with the regional call. It's a little bit broader area, as you know. So 89 last week, 79 this week.
Okay.
So
This
going in
graph,
the right direction.
Yeah, this graph here is New York State, and at this point in the state, we have 1,581. Last week, Fred, that was like 1,850, so that's come down by about 300 across the state.
That's right.
Great news. Next graph, morning census here at the medical center. We currently have 15, 9 on the floor, 6 in the ICU, and a very significant number about ventilators.
Just one.
Actually, now it's 0.
Oh,
so it was one this morning.
And that person came off.
Yeah.
That's fantastic.
I rechecked the app before we came here, so we have 0 on ventilators
That's
right now.
terrific.
So great work there.
So, you know, Dennis, this is all happening as the variants continue to grow
Correct.
in the community. So I think that speaks volumes about the value of the vaccines.
You talked about that before. Let's talk about that again. The variants in general tend to be more infectious.
That's right.
So one would imagine if this variant strain was the same strain as a year ago, if that was we would have had significantly higher numbers.
That's
but
right.
because the numbers are going down, not up, it means that the vaccine is working.
Absolutely.
Yeah, for sure. Let's look at the admissions and discharges here to the medical center. Again, notable, second time within a week, Fred, where we had 0 admissions.
That's
I think
right.
that was one of the days over the weekend.
That's right.
So great news. Let's roll out the percent positive in the capital region. It's 1.3%. If memory serves me correctly, we were as high as double digits 6 months ago at times.
Yep, we were 11% in January.
Right. So all of these good numbers, including the vaccine numbers, have led to a series of changes recently. One of those changes was pre-op testing. So if you're coming in for a procedure, if you're coming in for an operation, Fred, you talked about this last week. Let's talk about it again so people understand what is and what is not required before surgery.
So Dennis, I'd like to start by saying we're working on redoing our policy and procedures around this because there's more to it than just stopping something that we've been doing in the past. So having said that, the state is relaxing the rules, giving us more discretion. Right. So if you have been vaccinated and you're more than 2 weeks out from your last dose, you do not need pre-op testing. Or if you have had an infection and you're within 90 days of that, again, you do not need pre-op testing. If you are symptomatic or you're unvaccinated, then the state still is going to require pre-op testing. Now, we have to, as I said, work out the mechanism of how we're going to do this, how we're going to verify that somebody was infected, how we're going to verify that somebody's vaccinated appropriately. So we're hoping later this week we'll actually make that change in our testing, but we haven't done that quite yet.
So if you're a viewer and you're scheduled to come in for surgery, we're not expecting them necessarily to know those rules. We know the rules.
We know the rules.
We'll make sure that we follow the rules.
Right.
You're just telling the broader audience that the requirement to do it with every procedure is being changed.
That's right.
All right, very good. Fred, we talked about vaccination efforts. I know this weekend the vaccine sites were open all weekend. I told you 2 of my children were going in. They got vaccinated, which was wonderful.
Terrific.
A lot of activity this weekend in that new age group, the 12 to 15. And we'll bring some refreshed numbers on Thursday. But no doubt about it, our vaccine numbers still tend to be the highest in the state, which is great news.
That's great.
So which leads us to the next bit of information, which is we've all heard the news about masks, right? And obviously New York State was reviewing the CDC guidance. We heard from Governor Cuomo yesterday that effective tomorrow, Wednesday, New York State will follow the CDC guidance, which I think can broadly be defined as the following. If you are fully vaccinated, meaning 2 weeks from your last shot.
That's right.
And you are indoors or outdoors, in gatherings small or large, with some exceptions, you do not need to wear the mask anymore.
That's right.
So Fred, in that publication, there are certain entities which have their own rule sets, and hospitals are one of them.
That's right.
So what will that new rule mean for Albany Medical Center?
So Dennis, for clinical areas within the hospital, masking still required,
Okay.
whether you're a patient, an employee, a visitor,
Right.
or whatever. So it doesn't change within the hospital.
Okay.
Now, there are potentially areas within the physical structure where masking might not be necessary.
Okay.
We have to work through that. We haven't made choices yet. We certainly haven't changed our policy yet. So for people watching this video today, masking is still required at the medical center.
And we do know we have some off-site locations such as Broadway, Myrtle Avenue, Warehouse. That will all be defined in the policy.
That's right. We'll be very specific.
All right. So I think by the time people watch this video, the policy may be on the intranet, or perhaps if they're out of sequence, just look for the policy. A team is coming up with that today, the changes, and our communication folks are
Right.
working on that as well.
But Dennis, this is good news.
Oh, yes.
This is absolutely good news.
This is fantastic news. And I think the important message for me, at least, is the reason why this decision was made is because they believe that tremendous progress has been made with the vaccine. We're seeing the numbers go down. And so this is the CDC recommendation.
You know, Dennis, vaccination is so important.
Right.
You know, and lots of groups, businesses, schools around the country
Yes.
are thinking about mandating vaccines.
Right. So have we made a decision on this campus yet about whether or not we're going to mandate vaccines?
We haven't made a decision, but our infectious disease group has been talking about
Right.
this. And last night, actually, at the Med Exec Committee, they did bring forward their recommendation that once vaccines are fully approved,
Yes.
that we should mandate vaccines for our workforce.
So to remind ourselves, it was 2 years ago when we did just that with the influenza vaccine.
That's
so
right.
there is certainly precedent on this campus for doing that. So it sounds like a group of people are studying it and have not made a final recommendation,
That's
but
right.
will soon.
That's right.
All right, very good. Speaking of being outside, presumably without masks, if you're fully vaccinated, exercising. Fred, we've talked about this a lot. This is one of the themes that we've hit a couple times, the importance of health. Exercise can lower your blood pressure, it can lower your weight, it can help with diabetes control. All of these things we know are incredibly important when it comes to trying to not only hold off COVID or the severe effects of COVID, but
That's
other
right.
diseases. A couple articles recently published in important journals like the British Medical Journal have spoken about this.
That's right. It's incredibly important. And if you put it in the context, Dennis, of COVID, lots of people have been pretty inactive for the last
Yes.
year, have put on some COVID weight.
Right.
And this is an opportunity to work on that and get that weight down.
So I think we'll put those articles out on the Schaefer Library site.
Yes.
And maybe it'd be a good journal club.
I think that would be.
future to do that
I think
as
that
well.
would be. We'll have
So-
to tell Andy.
For sure. Lastly, Fred, before I came over here, I just took a tour of the Animal Research Facility here, and I want to thank Dr. Doug Cohn and Victoria Boppert. It was an incredible place. There's great work happening there. The workforce there is very proud of their work effort, and a lot of it is related to COVID
Yes.
and research related to
Yes.
COVID. So I congratulate them on the incredible mission they do, and I appreciate the tour.
Great.
So, we'll be back again on Thursday.
Back on Thursday.
And we'll have numbers, vaccine numbers, and we'll, by that point, certainly have the masking policy, and we'll be able to talk about that as well.
That's right.
All right, very good. We'll see you on Thursday. We ask that you once again, please take care of yourself, take care of each other, and we'll see you in 2 days.